My name's Laura Newman. I'm the clinical lead for the Youth Drug and Alcohol Clinical Services, and we're based in the Thwaites building at the James Fletcher Hospital in Newcastle. I started working in Hunter, New England in 2010, and so 13 and a half years now. And I joined Drug and Alcohol Services earlier this year, in February this year.
My name is Charlotte Ismay. I'm a transitional nurse practitioner for Drug and Alcohol Clinical Services for the Hunter, New England Local Health District. I've been working in Hunter, New England for almost 10 years, but specifically for Drug and Alcohol Clinical Services for over 4 years now.
My name's Josephine Heintzen and I am the Acting Allied Health Clinical Lead for Drug and Alcohol Clinical Services, and I'm based at James Fletcher Hospital.
My name's Stephen Weston. I'm a social worker for a little team called Assertive Community Management Team. We're based at the Thwaites building over on Watt Street, and yeah.
My name's Karen Sherlock and I'm a counsellor at the Stimulant Treatment Program, which is part of Hunter New England Health Drug and Alcohol Clinical Services. So I've worked for Hunter New England Health for around about 15 years all up, and in the drug and alcohol sector probably around 25 years.
I'm Deborah Lawson. I'm the clinical midwife consultant for substance use in pregnancy and parenting service, and I'm located here in Newcastle, New South Wales. I've worked for Hunter New England Area Health Service since 1982, and I've worked with drug and alcohol clinical services for the last 5 years.
My name's Emma Penny and I'm the clinical nurse specialist for Newcastle Pharmacotherapy Service. I've been working as a registered nurse with Hunter New England Health for about 9 years now. I've been working for DACS for coming up to 5 years. I started my career in ICU as a registered nurse and came to drug and alcohol as a registered nurse, and 2 years ago applied for my CNS2 position.
My name's Conjunct Professor Adrian Dunlop and I'm the Director of Drug and Alcohol Clinical Services for Hunter New England Health.
My name is Tim Harmon. I'm a registered nurse and I work in Newcastle Pharmacotherapy for DACS. So I've been a registered nurse for Hunter New England Health for about 4 years, but I've very recently moved over to Drug and Alcohol Clinical Services within the last sort of 3 months.
My name's Angus. I'm peer support worker here at the Drug and Alcohol Clinical Services.
My name is Arvind Kendurkar. I'm currently working as a senior staff specialist with the Drug and Alcohol Services. So I'm currently working in the opiate treatment program at Newcastle based at 670 Hunter Street. So that's my current designation. So I've been working with Drug and Alcohol Services formally since 2018, but I have worked previously with Drug and Alcohol Services since 2013, so more than 10 years now.
For me personally, as a transitional nurse practitioner, I get lots of supervision, working towards autonomous practice and having prescribing rights in the future is something that I'm working towards. So I'm working really closely with medical supervisors and other nurse practitioners in the service to become competent in this autonomous role. So I'm seeing a lot of patients under supervision in inpatient and outpatient settings, going to places like Maitland, Muswellbrook, lots of travelling to other places throughout the Hunter New England Local Health District to help provide a service out there as well. So it's lots and lots of different clinical work out, inpatient unit at Belmont as well, getting supervised there. So they're busy days and sort of caring for people with a variety of substance use disorders, from opioid dependence to alcohol dependence and everything in between, to gain that autonomous practice. But the service is so diverse. Everyone's, for a registered nurse, depending on where you are, your day-to-day work is going to look very different, but lots of clinical face-to-face care.
When I was working at the cannabis clinic, it was a mixture of client care, so you'd see up to 4 clients a day, and these can be quite complex clients as well, with complex presentations. You might have a clinical review meeting during that time, you would have team meetings, you would have time to debrief with your colleagues, you'd have a lunch break, and you can have a project as well. So I know we're part of research as well, so the team's looking at EMDR and bringing EMDR into the service as well. And I think the benefit of drug and alcohol is that you actually get to do therapeutic interventions. And so you can see a client and can see the progress that they make through that journey.
My role here is to provide counselling support to people who are wanting to make changes with their methamphetamine use. I work for a specialist clinic, and we work specifically with people whose primary drug of concern is methamphetamine. And I'm fortunate enough, to be working in a multidisciplinary team, which means we can draw on each other's strengths and problem solve together. And it's really rewarding work. We work with people for as long as it's helpful for them and as long as they're working on their goals. And day to day, that means providing counselling to people and, then some perhaps case management that might be required in their situation. And yeah, it's a really, really rewarding work, especially, if you're interested in social justice and in supporting people who've had, difficulties in their life. It's a wonderful place to work.
My day would look like, in the morning I will often contact clients either by phone or see them in person. Our service is lucky in that we're able to do home visits for some of our clients, and we can see our families throughout pregnancy and for up to 2 years after they've had a baby. So home visiting actually is a big part of our service, and it's great to actually be able to offer a service in the client's home where they're most comfortable, and you can really see what's happening for that family and how that family actually functions at home as well. So I would see clients. I also, as part of my role as clinical lead for the service, I do the intake, so all referrals that come through the service, I coordinate them as well, and I support other members of our team.
It definitely differs. At the moment, that it looks like being a team leader every day, and I help manage our wait list, so people who are coming onto the program and maybe people who are leaving the program. I also help liaise with some GPs who might be prescribing opiates for other patients, and I also try and follow up with everyone's bloodborne virus status and help treat them, as well as leading the discussions around decision making within the clinic every day.
It can be really varying. There's lots of kind of different roles in what we do as drug and alcohol nurses. It can be, from dosing people on maintenance pharmacotherapy to doing assessments, triaging the various issues that come in, working with people in various aspects of their life and trying to get good outcomes for them.
There is a huge amount of support through DACS to learn and to apply for different trainings. Just this year, I've already been able to do so much online training that was provided to me either from DACS or supported by DACS to engage in from other services. I've also been I've been accepted to attend conferences this year around drug and alcohol, and it's certainly supported the transition and I'm feeling more confident in the work that I can do.
I have never worked in a place that offers so much continuing education and supportive, and I say that without hesitation. You're always encouraged to do postgraduate education, and there's scholarship options for that. We have an excellent clinical nurse educator who encourages upskilling for things like motivational interviewing skills and other things that are pertinent to caring for people with substance use disorders. Support to go to national conferences, to network and meet other drug and alcohol professionals from around Australia as well. There is so much support and opportunity in drug and alcohol clinical services. There's something on, honestly, every week that you can go to, and I find management really supportive to partake in these activities and to improve your skills. It's amazing.
We have a fabulous clinical nurse educator who organises monthly education sessions across the district, and that they're internal speakers and external speakers as well. We support education and support training, so we will provide time off work. There is a small fund for going to training as well, and we're always looking at new training opportunities, and we also provide clinical supervision to staff as well, so they can access supervision monthly.
Yeah, we were really lucky enough to go to, our team in particular, we went to Darwin last year. We tend to go to the grand rounds over at the MARDA, which is always really, really useful. And Jo, who is the Allied Health Clinical Lead, she's always advocating for her Allied Health staff to get as much education as possible, which we're all very grateful and thankful for. I think there's a lot of education on offer in DACS, so I'm really grateful about that too.
The team environment is very supportive and there's some opportunity to learn and grow in the position that you're in. There is opportunity to apply for training that relates to your position, and there's some limited opportunity for attending conferences, but the workplace does support you in building the skills that you need to do your job well.
There is so much to learn when you come to drug and alcohol, but don't be afraid, because we've got a great clinical nurse educator and some really great learning platforms. And so usually what happens when people join our team and have not been in drug and alcohol before is we give them time to actually do their learning so that they feel equipped to do the job that they need to do. We don't throw them straight in. We make sure that they feel like they can do that task, and we support them in whatever learning needs that they have. So we'll send them to courses, we'll get them to do some online training, and we work alongside them for a period of time until they feel confident that they can actually do that work themselves.
We have our own internal training that we provide, sort of based on our particular needs. But there's lots of stuff available online these days. The professional societies, so APSAD, they do a webinar series. DANA, they do different online education. NCRED, the National Clinical Centre for Research in Emerging Drugs, they also provide online services. NDAC provide lots of the different universities do. So there's quite a wide range of things available. And yes, we do support our staff to go to conferences too. So try to make sure they can not only learn things but also network with other clinicians across the country.
There is definitely scholarships offered. I haven't applied for any myself. I was encouraged to do a graduate certificate, which is what I went ahead and did. I didn't apply for a scholarship, but I know that there is scholarships available for staff wanting to do further education.
Outside the normal kind of learning and development things, there are a lot of online stuff. I've been here a short time, but I've already seen some of my colleagues go away to some really great conferences and things outside of the Newcastle area. So I'm looking forward to maybe putting my hand up for some of those in the future.
As a district whole, I've found DACS incredibly supportive, and certainly because we do support young people to transition from youth services into adult services, being able to draw on the experience and the skills of the other services that might continue that support for those clients has been wonderful. I've found that the clinicians are always willing to share that and help out the other services, and it just seems like a very supportive service to work in.
I'm supported to go out, so I've been out to Tamworth once, I've been to Taree and Foster, and I'll be going out again a couple of times in the next couple of months, so we can meet with people. I can do rounding, allied health rounding with them. I also attend as many clinical reviews that I can that the teams have, so I'm on the teams meetings with them, and I will pop in and see if there's any clinical needs. So just trying to be as accessible as possible. I also send out a weekly email to the allied health staff, just updating them on training opportunities and other information that I think is relevant to their clinical practice as well as their professional development.
My background's intensive care and paediatrics, and was looking to work as a registered nurse in the community. And in making my decision, I wanted to stay working in the public health system. Addiction and drug and alcohol was my preference for the simple reason I'm a family member of someone with a lived experience of substance use who have accessed the services here before, and they showed him such care and compassion that I felt really compelled to come into drug and alcohol.
I've worked for H&E Drug and Alcohol Clinical Services for 15 years, and I've always loved working in drug and alcohol. So I've been working in drug and alcohol for now 27 years, and I've worked across Australia. And when I got the opportunity to work for H&E, I jumped at it because I thought that it's very evidence-based, there's a lot of support, and the team was fabulous. So I knew that coming in, so that's why I came and worked for H&E.
We've got a client that comes into the service. So part of the ACM team were ITLOs, which is an abbreviation for Involuntary Treatment Liaison Officers. And that is when somebody's so unwell and we're so concerned that they've got to go into a treatment facility for a short period of time. So this one particular person came through our service. Unfortunately, that person had to be IDATed, which is involuntary treatment. However, fast forward 24 months later, that person's still sober and living the best life. Recently just bought a new car, recently just got a job, and she actually came back into the service last week and we had a sit-down counselling session with her, and she was so thankful. And at the end she turned around and she said, I owe my life to you and I'm so thankful. Thank you so much for doing this, what you did for me. So I knew at that point, yeah, made the right decision. This is the best kind of job.
Being in a small clinic, we frequently have patients get in touch with us a year or two after they've completed their treatment and letting us know how they're travelling and thanking us for supporting them, and it really makes it worthwhile.
I've always had an interest in drug and alcohol nursing. I think the pathways to mental health nursing were much easier. There were a significant number of new graduate positions when I finished uni, and not so many drug and alcohol positions. I'd managed to score some drug and alcohol placements at university, which really kind of got my interest started, and then saw a position come up, applied. But yeah, I've always had that kind of interest in the field. Yeah, a lot of crossover from mental health nursing, a lot of quite similar consumers, and a lot of people that are quite stigmatised who I really feel a great passion for supporting.
So I just wanted to help people. I think people who use drugs are very stigmatised and disadvantaged in our community, and I just wanted to do what I can to break down that stigma and break down some of the barriers to people accessing services here.
I've found that working in DACS, as a social worker by background, I'm using all of my social work skills. I certainly feel like I'm upskilling every day. And again, being able to share that with the rest of the team and draw on their skills to continue to build mine has been really wonderful.
What I've observed from speaking to people who might be thinking about coming into community drug and alcohol is they're afraid they might lose their clinical skills, and that is not the case at all. I find that having a background in critical care has really set me up well. You're using your clinical skills all the time on a daily basis, and a lot of people who use substances, sometimes we're the only healthcare service that they trust or feel comfortable with. So you're linking with other healthcare professionals and holistically caring for people with substance use disorders. It's very holistic, looking into, for example, diagnosing and helping treat bloodborne viruses. It's very complex and you don't lose those clinical skills.
You definitely don't lose your clinical skills. I use my clinical reasoning every single day, whether, about our treatment methods for our patients. I think you also gain different kind of clinical skills. You learn how to, de-escalate a situation, and you learn how to really actively listen to our patients and learn how to treat them holistically while keeping all those other clinical skills. I certainly don't feel like I've been at a loss from moving into the community section, or from leaving ICU. I feel like I've actually gained a whole lot more as a nurse.
Where we work, we're right across from Newcastle Beach, so lunch times and just break times, being able to walk across, see the ocean, see the whales, the dolphins, it's incredible. So just the environment that we get to work in is pretty special here.
There are so many good things about working for drug and alcohol clinical services as a nurse. We have a variety of teams that you can work for, so everything from pharmacotherapy, so treating our patients with opioid dependence, to child, youth and family. So we've got youth, drug and alcohol, and our subservice, substance use in pregnancy and parenting. We have peer workers that work here who are people with a lived experience who help us every day improve our services. We have a research team, which is absolutely incredible. Some of the greatest minds in drug and alcohol research, in my opinion, where you can participate and focus on clinical trials and participate and learning how to implement new cares into treatment.
It's lovely. There's so many teams here. They're all really supportive. So, you can have those impromptu meetings about a client to get multidisciplinary input. It's a fun team. There's always laughter. Even though that we're working with really some really challenging and complex issues, that we're always really supportive of each other, and we can have a bit of downtime and we can have a chat about things. But yeah, it's very supportive. You know, we'll have Friday lunches, people might go for drinks after work, but yeah, very supportive. And having this courtyard that we're sitting in now, you know, people congregate here for lunch a lot as well, so it's very good. And our admin's amazing and very supportive as well.
I feel that every day that I work, it's just such a privilege to work with families and to be able to support them in their journey. Of course, we work on their goals, not our goals, and it's just lovely to see when families are given the opportunity to make decisions that improve their lives and to change, particularly when they've got small children or they're pregnant. Pregnancy is a great motivator for change. It's just lovely to be able to walk alongside them in that journey and actually see that they're actually reaching their goals and being the parents that they want to be.
We see people get better, not necessarily get better, but improve in their lives or reach their goals every single week. I could tell you 100 stories about people who have really succeeded or have, you know, are no longer having to go to frequent presentations to hospital or have some kind of, now have a support system in place. I think DACS is an area where you see good things happen a lot.
Every morning we come together as a team where we have a safety huddle, we call it, where we also look at what's happening for everyone that day, what support each person might need to just make it a smooth day and make it as helpful for the clients and for the staff. We also look at intake and new referrals that we've received and allocate from that meeting. And then throughout the day, we will see our clients. We'll often have different education opportunities throughout the week, as well as different supervision and support options throughout those weeks as well.
There's formal and informal supervision. So the formal supervision is provided monthly at a minimum to staff by either experienced drug and alcohol clinicians or senior clinicians, or we can do it external to other health providers within health, and that's monthly, that's supported, so it's during work time. And then we also have the informal supervision, so if you're struggling with something with a client presentation, you can always go next door or come to me or to other, or medical, they're on call as well, so we can always get supervision about that client care at point of concern.
I have been supported through the whole way since I've been in DACS, and have been encouraged to do extra study, given the time to do extra study, and was encouraged to apply for leadership positions in like the one I'm in now.
We have medical rotations, so we have first or second year postgraduate doctors who do 10-week rotations with us in the withdrawal unit at Belmont Hospital. That's great exposure for them. Most of them don't end up becoming drug and alcohol specialists, but in terms of the rest of their career, you know, it's really good exposure to in-depth drug and alcohol work in a very supported environment, so they understand some of the basic practicalities of helping people try to withdraw from substances. We have different other registrar positions. So at the Kelvin Mater, there's a registrar position that goes between gastro and drug and alcohol, and that's a good mix of, you know, different drug and alcohol and gastro type problems, and there's lots of overlap there. Again, those people don't, you know, all go on to become addiction specialists, but we have had doctors come through who then decided to do addiction training. Psychiatry is another one where we have people doing usually 6-month rotations, sometimes they're 12-month rotations, and we have had addiction psychiatrists come through. We're one of the few places outside of Sydney, New South Wales, that have addiction psychiatry training and addiction medicine training, so that's, you know, really important for us to have people going through our local program here, and of course, you know, they know the local service as well and get a chance at having time not just in Newcastle but also across the district.
I think the benefits of those multidisciplinary teams are that you're getting lots of different perspectives, lots of different skill sets that bring a lot to the table for every single consumer every single time. So I really like, getting perspective from the nursing staff that have that day-to-day interaction and rapport and relationship with our consumers. We've got doctors, pharmacy and allied health that really kind of, contribute in getting good outcomes for our patients.
I would say certainly if you're looking at coming to DACS, then to contact DACS and ask about it. Particularly there's so many different opportunities because there's so many different streams within DACS. So whatever your interest might be, there would be something for you. I would also say to back yourself and the skills that you have, what you could bring to that team. And even if DACS isn't your background, if you haven't worked in drug and alcohol before, knowing that so many of the skills that you would have developed in other areas are transferable, and just calling and asking, speaking to someone about what that could look like.
If you're thinking about making the career change into drug and alcohol, I highly encourage, as a nurse, I would highly encourage you to reach out to other nurses who work in the service. I'm happy for people to reach out to me and can tell you the ins and outs. I'm very passionate about getting nurses into the service. So I would definitely speak to someone in the service. There are some other great online resources that people could look at. Our professional or peak body is DANA, the Drug and Alcohol Nurses of Australasia. So I encourage people to check out that website as well as Your Room, which is an amazing website that for health professionals to learn about harm minimisation and other principles of caring for people with substance use. So I would encourage those things as, practical resources to access, but also to have an open mind as well. This is profoundly rewarding work every single day, and have an open mind because again, some stigma associated with addiction can, in my opinion, make people think twice, and in my experience as well, but it is extremely rewarding, so keep that open mind.
The first thing I would do is always tell them to ring the manager who's advertising it and get some more information to see if it sort of fits with what they want to do and where their career wants to go. I would think about how it fits in with their career development and think about what they could offer to drug and alcohol as well, and how their experience would go in this position.
I would definitely say the culture is great. Everybody is super friendly. The clients are the most colourful clients you'll come across, and there's definitely a good time to be had in drug and alcohol clinical services. It is a great service, you're well supported, and the clients are some of the best clients I've come across.
I would say to go ahead and apply, even if you're not sure whether your area of discipline is what the service is looking for, because it is a multidisciplinary team, and sometimes positions are advertised as social work or psychology, but there might be opportunities for people who bring other strengths to the service. You do need to have some experience and some university qualifications. However, if you do have those things, then I'd encourage you to apply.
I would say just apply. With nursing, the majority of the work that we do is learning on the job as it is, and it's a really wonderful, supportive environment here. I think the most important thing is to really have respect for clients and to really have that non-judgmental and empathetic way of working with clients, and all the other stuff we can learn as we go along, but it's really about understanding the stigma and the shame that our clients have and how we can work with them to actually improve their outcomes.
DACS is a great place to work. You get to work with really vulnerable people who might not have a good experience with the healthcare system or have a good experience with day-to-day people. They're people who are very judged by society. So every day is rewarding because you know that you're really helping people who might not otherwise get the help. So I would say to do it, that we're a great service. There's lots of opportunities to grow your career, to follow different leadership pathways or nurse practitioner pathways or education pathways, and there's so much support available for you to do that.
It's always good to make contact with people locally and ask some questions about what the role's actually like, and we're very happy to take calls or emails. If people want to get a sense of what things are like locally, I think that's a good way to do it.
I would say that looking at the team that I work with, and as I said, really complements each other. We have people from all different nursing backgrounds, from the hospital setting to mental health to community-based nursing. And I think that kind of those varying backgrounds really complement each other when supporting our patients and looking at things from all different angles and perspectives.
Absolutely encourage anyone to apply. So definitely would be open to talk to any health staff in any discipline if they were interested to work within drug and alcohol services, but specifically being a health professional, medical professional myself, definitely would be happy to support any medical staff who would like to look at their career within the drug and alcohol services. So I regularly give my lectures to GMOs, registrars, as well as psychiatrists. So and definitely happy to talk about how to get into drug and alcohol services. If anyone is thinking about drug and alcohol, but you are worried about what, if, how, and what sort of client exposure to have, come and talk to any of us. We are more than welcome to show you around, show you how the client exposure works. It's a straightforward service, just like follows the model of any treatment model which we have in the field of medicine. And I would say that because we are able to integrate and hold on to individuals for a longer period of time, the results what we get is pretty outstanding. You'll be surprised to see those results, and 100% job satisfaction guaranteed, I would say.
Oh, well, I'd say it does take a certain kind of person to work here, I think. You need to have a passion for helping people who use drugs, and you need to have a bit of a, I think, extroverted personality and ability to get on with people from all sorts of different walks of life. But, if that criteria fits you and you'd like to come along and help people who use drugs, then give it a go, because that's what we're doing here. That's our main driver.
I found the transition into DACS quite smooth. I came over from child and adolescent mental health into youth, drug and alcohol. I was really well supported by the team and the overall DACS service to learn more around substance use intervention, what's evidence-based, and the most helpful ways of supporting young people and their families in drug and alcohol.
I was really lucky because I had a colleague who had come across to drug and alcohol from intensive care a few months earlier, and I was able to talk to her about her experience in the role, so had a bit of inside information as well. But the transition was really quite straightforward and amazing.
The transition was surprisingly easy, especially with social work. When you're working with people, not that much different, regardless of what issues they've got going on. But because of the modalities like DBT, motivational interviewing, CBT, that I knew all of those things before, the transition was really smooth. And I just think when you're working with people and you can bring your best self to the situation, then it makes a big difference. So no, not really too much of an issue with transitioning into the drug and alcohol space.
Drug and alcohol's always been my passion. I studied psychology at uni, but then did a postgraduate diploma in health science, drug and alcohol, and I've worked in the field pretty much ever since.
I worked as a midwife and child health nurse for 26 years at John Hunter Hospital, and I worked with vulnerable families, mostly families that had drug and alcohol issues. And when Drug and Alcohol Services got some extra funding to develop a new service, substance use in pregnancy and parenting, I applied for that position because I felt that it was a way to use my midwifery and child health skills in an area where there's a great need.
I felt that I wanted to do some more work in primary care rather than the intensive care side of things, and I wanted to work in the community, so I applied for a job and kind of ended up, the job that was going was in the pharmacotherapy unit, and I thought it would be really interesting, and that's how I ended up here.
Yeah, I like that drug and alcohol nursing is quite holistic. We're looking at physical health of people, mental health, which is my background, and also the substance use issues as well. There's a lot of psychosocial issues too that we're dealing with. So I feel like when we're assessing patients, when we're managing patients on our program, I find that, a lot of my background lends itself to this type of nursing, and really feel like I can make a big difference.
So that was a big part of my career progression. I would say transitioning from mental health, I'm a psychiatrist by training, into addiction psychiatry and then addiction medicine, and then with the better career prospects, education support, so I decided to move to drug and alcohol in 2018, and here we are.
We can go to Tamworth. Hayley and I have been up to Moree once before to help support a staff member. Predominantly we're based in Newcastle, but we can get around. I do district-wide consults as part of my role. That's usually on the phone, but always happy to jump in the car. Tomorrow we're going to Sydney because we're trying to get a client into rehab, and we're going above and beyond to get that patient into the best service possible. So we're doing that tomorrow. So it's a little bit of a different thing for us, yeah.
Our particular service, we only service our 3 local government areas. We do service John Hunter Hospital, so we go up to the high-risk antenatal clinic and we provide some support there for our women and for the other staff there as well. But my role is I actually do provide support and education across the district as well. So I'll often get calls from rural practitioners saying, I've got this woman, I'm not quite sure whether to be concerned or not to be concerned, and what I can do for them. And I also offer a lot of in-service education to maternity and neonatal and child and family health services as well.
I've done work in Tyree, where I stayed there Monday to Friday and came home on the weekends. I've done work in Moree, where I drove up on a Monday and came home on a Friday due to the length of travel it is to get to Moree. So no travelling on the weekends, still fit into the Monday to Friday life. So the Tyree job, I was the nurse unit manager there for a couple of months, and I got to meet and work with the staff there. It was more leadership there and a little bit of education, not around drug and alcohol, but more around how our Newcastle clinic does things compared to the Tyree clinic, and how the skills could be interchangeable from different locations. And the Moree clinic was probably more of a learning curve for me than it was for the staff there for working in a rural area, which is managed by the Tamworth team, which is so far away.
I do rural clinics at the moment at Armidale, Inverell and Moree, Narrabri. So that's where I do most of my clinical work. I also do some clinical work with the Substance Use in Pregnancy Service that's based here in Newcastle. But I do cover for other clinics from time to time too.
I'm solely based here in Hunter Street in Newcastle, but certainly there are other roles within the service that if anyone's interested in they could look at that are a bit more community based out and about.
Since moving to DACS in 2018, so I have had the opportunity to rotate around drug and alcohol services. So I would say that I have worked around almost all the sites within Newcastle, which is very fortunate to get an exposure of different teams, how different team dynamics works, what are the client network works, what support services. So before moving to the opioid treatment program completely, I worked with the assertive community management team, which is a high risk community support team.
We have entry-level positions and then we have more experienced positions. So we're obviously looking for people ideally with a qualification for the allied health staff or social work, psychology, OT, and so we want that. And depending what position it is, they could be entry-level, so they'd be in a team, so that can be with minimal experience. And obviously the people with more experience, we'd want them to be able to make clinical judgments on their own, especially if they're in an isolated position as well.
It's always an advantage to have some prior drug and alcohol clinical experience, but we do take people who don't have prior experience. And I guess the biggest single thing that is usually pretty clear early in the piece is how people go in working with people with drug and alcohol problems. And usually when people have got drug and alcohol problems, it's not just drug and alcohol problems, they're also mental health challenges. People often are, come from lots of social disadvantage. And there's multiple other things. So I guess it's capacity to work with somebody who has all of those sorts of challenges. Our different teams have to and need to provide good clinical supervision because there's lots of challenges in working with people who have lots of challenges they've got to sort of face and work with. So that's really important that we do that and we do that well and support people strongly in those areas. But yeah, that's probably the most important thing, and it's not for everybody. And sometimes people try it and it doesn't work for them, and that's okay. But there's generally some good skills people can learn in working with people with drug and alcohol problems.
You don't have to be formally trained to begin with these services. We can train you up. We have full-fledged training program for medical team, plus excellent supervision support. And I must say, I'm also the chair of the training committee of College of Physicians. So I do accreditation across Australia and New Zealand. So Hunter New England is one of the very few sites which has all the services at one site. There are only very few which you can count on the fingertips which they are available.
Working in the team is wonderful because it's a multidisciplinary team, so we can draw on the skills and expertise of so many different disciplines. We're all very supportive and willing to share our experiences and skills. And particularly in the service that I work for, in the youth drug and alcohol service, we can work collaboratively, so in co-clinician setups where we can, on the job with the client, share those skills and support each other to make sure that we're providing the best practice we can.
Another great thing working for DACS is it is highly multidisciplinary. Every team has a group of, or is made up of, registered nurses, other allied health professionals, including clinical psychologists, registered psychologists. We have midwives, we have social workers, we have a neuropsychologist, occupational therapy. It is very, very multidisciplinary, and of course a wonderful range of addiction medicine specialists who all teams work with closely, as well as nurse practitioners and transitional nurse practitioners.
I am the allied health clinical lead for the district, so I support the allied health staff across the district, so up to Tamworth and Moree and Taree and Foster and down in Newcastle. So my role is to support their clinical practice and also support their education and development. And the great thing about the team is that you have support from so many other people. So you've got your team itself, you've got the building here we're at, you can always go in next door or talk to people about a situation you're having or a clinical challenge that you're presented with. And then there's medical support, admin support, and then we've got the other support like the Aboriginal health workers and the peer workers that can all make the client journey as successful as possible, and always using evidence-based and education and support as well.
Working with the team, it's really good. We're assertive, which means that we get to go and do lots of home visits. So we work with clients pretty much every day. The team dynamic is great. So it's everybody in drug and alcohol, in DACS in particular, is very, very friendly and very opening. So working in that team dynamic is really, really nice. And you get to be out of the office quite a lot of the time, which is also really nice, you know. The whole of the multidisciplinary team is great because you've got on hand the DACS counsellors. If you've got somebody that's a little bit young, you can go to YDACS, which is the youth service, and you can go to the cannabis clinic and the stimulant clinic. So there's everybody surrounding each other, so there's so much support. And on a personal level, it's great to find a supervisor as well.
I'm in a small team of 3 clinicians. We also have admin support, and admin provide wonderful support here at our service. And of course we have a manager, and we have peer support workers who also support the team. And I feel really fortunate to work in the team that I do. It's very supportive and caring, and it helps with really growing job satisfaction.
It's great working with a multidisciplinary team because our clients are so complex and they have so many psychosocial issues that come along with their drug and alcohol issues as well. So it's wonderful to have the backup of some really skilled allied health clinicians and our medical officers as well.
The team that we work with is really brilliant. We're really patient focused and try and make our decisions based on our patients. And we have a multidisciplinary team within our own unit. Our unit itself is quite small compared to the broader area of DACS. And I've been fortunate enough to be able to work in different areas around DACS and travel to different areas of New England Health and work and meet other people of our service.
Come and join us. We're just such a great workforce, and particularly here in Newcastle, we've got such a beautiful setting. I've never worked with such supportive and inspiring colleagues. Everybody's really motivated to make great changes, and because our clients matter, our patients matter, and everybody has that focus, and it's just a great place to work.
I'm quite a new starter, as I say, within the last 3 months. And there's staff that have, anywhere from sort of 5 to 20 years experience in this particular service. I find it really, really supportive and cohesive group. Really helpful for me as a new starter. I felt very supported.
Yeah, I'm enjoying it. Everybody is very friendly, very accepting. So our little team, I guess, is just 3 people, the peer support workers, but we do work across all the different teams. So we work with all sorts of different people. We work across all the different teams with the cannabis clinic, stimulant treatment program, Lakeview, research. So we get to work with all sorts of different professions, all sorts of different people.
I started in drug and alcohol 15 years ago as a caseworker at Newcastle Pharmacotherapy Service, and then I went to the cannabis clinic as a provisional psychologist. I did my 4+2 registration training there. I then went to my Masters of Clinical Psychology, so I'm an endorsed clinical psychologist, so that's where I come from, that background.
I've worked in H&E for about 5 years now, maybe 6 actually. Before that, I worked in aged care for many, many, many years. That's where I started my life out, my professional life. And I got into drug and alcohol. I just had a passion and an interest for it. And when I did eventually get into drug and alcohol, I've definitely found my people, and I really loved where I ended up. And DACS has definitely been one of those places that I've really enjoyed being at.
17 years working as Director of Drug and Alcohol for Hunter New England, and this year will be my 30th year in drug and alcohol. So I worked in Victoria before. I was in New South Wales for about 14 years or 13 years in the NGO system at Turning Point Alcohol and Drug Centre, and then I've been up in Hunter New England since then.
I'm a mental health nurse by trade, so formerly a mental health nurse within the Hunter New England health area. I feel like there were a lot of transferable skills from mental health nursing into drug and alcohol nursing. I like working with marginalised communities, disadvantaged people. There's a lot of stigma associated with drug and alcohol, and a lot of people that have alcohol and other drug misuse. I like working with a lot of those consumers.
Before moving to drug and alcohol, I was working as a staff specialist with the mental health services within Hunter New England. So I was previously employed in Tari in the Manning region. Then there was an opportunity to work within the mental health and substance use services, which is dual diagnosis unit based at Martyr. So I moved to Martyr in somewhere around 2012. Then I got interested in the field of addiction, so I decided to do the addiction psychiatry training. So as a part of the training, the mental health was not accredited at the time, so I had to work out a plan for training. So essentially I carved out a training for myself as an addiction psychiatrist involving the drug and alcohol. I must say that the support from drug and alcohol services has been enormous. So the moment I requested from the support, and then I started my training as addiction psychiatrist, so I was based at Martyr, but I used to come here with drug and alcohol services a few days a week to complete my training. So I did the training working with the mental health, and after completion of my psychiatry certificate, then I was offered to whether I would like to do an addiction medicine fellowship, which is another additional training as a part of through the College of Physicians, which is different to the College of Psychiatrists, which means that I'm a dual fellow. So at the time, Dr. Sally McKenna and Craig Sadler, they both were available for me to supervise, and that worked out really well with the ongoing clinical support which I had, the clinical supervision, the one-to-one individual supervision, the assessments process. They supported me every step of the way, and then I got my fellowship in 2017 by memory, and in 2018 there was an opportunity which came up in drug and alcohol, so I decided to move on. So since my move in 2018, I would say that my career progression has not stopped. I've continued to progress, and I'm also working a little bit in the field of medicine. So Professor Dunlap, as I say, he is incredibly supportive. So he's never stopped me from training, so I keep studying. So, and I'm doing my PhD as well, with him being one of my co-supervisors. So there we go, we keep going.